Assalamualaikum and good morning, everyone. I think we'll wait for another 4 minutes to allow attendees to join the session. All right. I think we shall begin. There's already about 60 participants in the room. All right. Our speaker for today, Associate Professor Dr. Wan Amir Nizam, received his medical degree from the Royal College of Surgeons of Ireland, RCSI. He worked as a physician for 9 years before earning his PhD in pharmacology, a postdoctoral fellowship with Professor Robert Jones, and a position as a visiting scholar at the University of Strathclyde, Glasgow. He currently works at University Sains Malaysia as a senior lecturer of pharmacology, where he teaches pharmacology as well as biostatistics. He is currently researching medicinal plant phytochemicals in animal models of diseases like type 2 diabetes, obesity, hypercholesterolemia, and colorectal cancer. All right, twist. On a local and international level, he is active in several societies. He is currently the Vice President of the Malaysian Society of Pharmacology and Physiology, MSPP, and a member of the Executive Committee of the Malaysian Laboratory and Animal Sciences Association, or LASAM. He is also an active member of the International Advisory Board Committee of the British Pharmacology Society, or BPS. He is a lifetime member of the Malaysian Biomedical Science Association, or MyBiomed. It is a pleasure for me to welcome Associate Professor Dr. Wan Amir Nizam Wan Ahmad, and also my dear friend, to deliver his talk. Please help me welcome Dr. Wan Amir.
Okay, thank you, Izuddin. Can you see my slides?
Yes.
Izuddin, can you see my slides? Okay. Okay, thank you for the brief introduction by Izuddin, my dear friends. Okay, so basically today I'm going to share our research on these flavonoids and also the meta-inflammation in diabetes. So why diabetes actually is very important now, as you can see, as predicted by IDF, it shows that currently there's a 51% increase of diabetes worldwide. And it's been predicted that by 2045, there's going to be 700 million cases over the world. In Malaysia, 1 in every 5 adults has diabetes. And when you translate it with the current population of Malaysia in 2020 of about 32.7 million, there's about 3.9 million people that age of 18 years and above have diabetes. So it's quite a worrying thing actually. And as you can see here, it's also overall rise in prevalence from 13.4% in 2015 to 18.3% in 2019. So over the years, actually, the prevalence of diabetes is increasing in Malaysia. So what about this so-called meta-inflammation and in relation to type 2 diabetes? The pathophysiological of type 2 diabetes is basically the combination of 2 primary factors. Firstly, you have this beta cell dysfunction resulting in defective insulin secretion. And also you have this insulin resistant or IR, which translated to inability of insulin sensitive tissue to respond to insulin. So this will result into the malfunction of the feedback loops between insulin action and also secretion, which at the end resulting into the hyperglycemic state. And as you know that in type 2 diabetes mellitus, obesity actually is the strongest risk factor. And obesity is associated with the metabolic abnormalities which result in this insulin resistance. So IR is basically lead to impaired suppression of lipolysis. Then you have the impaired glucose uptake, which leads to glucose intolerance. And also last but not least, the enhanced free fatty acid release into the plasma. So what happens when you have this elevated plasma free fatty acid? It will accumulate in the tissue, especially in the liver. When it accumulates in the liver, it will result in this impaired insulin signaling. And you're going to have this promotion of gluconeogenesis. And you also have the so-called impaired glucose-stimulated insulin response, which result to induce this type 2 diabetic mellitus development. And as we know, in what they call obesity, there's a lot of adipose tissue or excess of adipose tissue. And this adipose tissue is basically a metabolical dynamic tissue that's capable to synthesize a wide range of biological active compounds. And this biological active compound is basically can regulate metabolic homeostasis, which include the immunity, coagulation, body weight homeostasis, glucose, and lipid metabolism. And the abnormal increase of adipose tissue mass and size is correlate well with the macrophage-mediated inflammation. So in obesity, you have the so-called condition of hypertrophic adipocytes. So it will contribute to this increasing of the pro-inflammatory cytokines. And this comes the condition that's so-called meta-inflammation. So meta-inflammation is basically a chronic state of low-grade systemic inflammation that because of this so-called excess adipose tissue. And also it says that in meta-inflammation is so-called sterile inflammation because it not involve any organism. And the underlying mechanism basically in this meta-inflammation is you have oxidative stress and also you have this pro-inflammatory kinases. And that's why the aim of the treatment currently or the latest therapeutic option of this type 2 diabetes mellitus is basically aimed on these anti-inflammatory properties and also their hypoglycemic effects and their main modes of action. So the classical, say for example, oral hypoglycemic agent like metformin basically also have these anti-inflammatory effects besides their primary modes of action. But the main problem with this so-called, say for example, like metformin, a prolonged use of these drugs can lead to a lot of unwanted effects, say for example, like lactic acidosis. So that's why we need to find alternative resource with minimal adverse effect, but induce the effects alike metformin. So basically, our research is we study on this plant that is called ethylene jira aletheia, or in local name we know as kantan, or also known as the tosh ginger. And this plant is basically native to Southeast Asia. It is high in flavonoids, mainly anthocyanins. It's also high when we tested the in vitro anti-diabetic properties. Other studies also show that it has the anti-inflammatory properties. So for this study, basically, we studied the effects of the plant that processes into the extract on this diabetic type 2 model of the rats. So basically, we induced the rats to become obese for 6 weeks with high-fat diet. Then we used streptozotocin at low dose to induce the rats to become diabetic. The extract were given orally for 6 weeks, and at the same time were also given metformin as a control drug. At the end of 6 weeks, the kidney was taken out for histological study using 3 types of the stain, basically H&E stain, periodic acid shift stain, and also meson trichrome stain. We also take the plasma to measure the inflammatory markers and also oxidative stress markers. So from our study, we've shown that the extract significantly reduced the fasting blood sugar, fasting blood glucose, comparable to metformin at the end of the 6 weeks. And as you can see, in untreated diabetic, the fasting blood glucose persistently high throughout the 6 weeks of the study. For body weight, as we know that in diabetic, as you can see here, there's a significantly reduction of body weight throughout the study, and especially at the end of the 6 weeks. Whereas the treatment with the extract and also the metformin actually prevent the reduction of body weight in the diabetic rats. What about the renal function and also lipid profile? As you can see, the extract significantly improve the renal function and also the lipid profile when compared to the untreated diabetic rats. And we also measure this AIP, or atherogenic index of the plasma, which actually measure the risk to develop atherosclerosis. And as you can see, there was a twofold increase of AIP in untreated diabetic, whereas by treatment of the extract and also metformin basically reduced the AIP more than 50%. So there's a reduction of the risk to develop atherosclerosis with the extract. We also measure the microalbumin in the urine. As you know that the presence of microalbuminurias actually signify the kidney dysfunction or renal dysfunction. And as you can see, the extract and also the metformin significantly reduce the microalbuminuria as compared to untreated diabetics. When we open up the abdomen of the kidney, as you can see in untreated diabetic rats, you can see there's a loss of the peritoneal fat as compared to normal rats and also as compared to the obese rats. And you can see that the intestine was bloated, and also there's a thinning of wall of the intestine in the untreated diabetes. So let's go to the staining of the kidney itself. So this is the H&E stain. As you can see, there's a presence of the normal glomerulus with the mesangial cell that's scattered appropriately within the glomerulus. But however, as you can see, the Bowman, also the what they call glomerular basement membrane is a thin layer with a good Bowman space. In untreated diabetic, there's a mild thickening of the glomerular basement membrane that is associated with the reduction of the Bowman space. And also you can see that the mesangia basically scattered increase in the part of the glomerulus. And also you can see there's a moderate tubular ventilation as compared to the normal tubules. And the treatment with the extract basically reduce the appearance or the damage to the kidney. Next, we use this PAS stain or periodic acid shift stain. So basically, PAS stain positive will detect the presence of this carbohydrate within the tissue. And we stain as the purple actually. And you can see there's no PAS stain positive. But in untreated, you can see that segmental dense PAS positive staining associated with the focal tubular atrophy. And you can see there's a focal tubular atrophy that is associated with the thickening and also wrinkling of tubular basement membrane. And also you can see that the affected tubule actually much smaller as compared to the normal tubules. And also you can see the Fahmy cells within the tubular cells. On higher magnification, you can see the positive PAS stain within the mesangial matrix. So this actually suggests the presence of the glomerular sclerosis. And within the kidney that's been treated with the extract, you can see there's no more what they call focal PAS stain positive. In mesentrichrome stain, basically it will detect the presence of the collagen. And you can see there's no what they call collagen stain within the glomerulus, but you can see within the vessel itself, there's an amount of collagen. There is normal appearance. However, with the untreated diabetic, you can see that the increase of the amount of collagen deposition, stained as blue, and also you can see there's a focal fibrosis of the glomerulus and also the tubules, signified by the red arrow. With a normal glomerulus, basically, when treated with the extract, you can see now the appearance is much more normal and comparable actually to normal kidney. Next thing we measure this ELISA. We use ELISA to measure the inflammatory also fibrosis markers. For the inflammatory, we use interleukin 6. As you can see that in untreated diabetic, there's a significantly high interleukin 6 present as compared to the normal rats. But with the extract, actually the interleukin 6 significantly reduced and is comparable with the metformin. For the fibrosis marker, which is TGF beta and also CTGF, which is usually also associated with inflammation and is progress, you can see that significantly higher in the untreated diabetic with the treatment of the extract and also metformin. There's a significant reduction in the fibrosis marker. And as we know, in meta-inflammation, there's also increase of the oxidative stress markers. And as you can see, we measure the reactive oxidative stress markers, and you can see that the extracts and metformin basically significantly improve the ROS markers as compared to the untreated diabetes. So what we can conclude from our study found that the Telanjera elitio or bunga kantan, which is high in flavonoids, basically reduce the hyperglycemia and also the body weight of type 2 diabetic rats. In concurrent, is also improve the function and histological damage in the kidney of the diabetic rats. And the extract also has been shown to significantly reduce the inflammatory markers. In this case, is the interleukin 6. And in concurrent, the fibrotic markers, which is TGF beta and also CTGF, also significantly reduced. So overall, the study suggests that this plant, which is Telanjera elitio or bunga kantan or kantan, actually basically has a potential to be used as the one of the modalities or as an adjunct therapies for this diabetes, especially in type 2 diabetes, and especially targeted into the meta-inflammation process. However, there's a warranted more study to elucidate more on their mechanism, specifically on this meta-inflammation. So basically, this is our groups, and as you can see, there's only 2 males, plus me, only 1 male that currently in our group. So male actually become more rare species in this research world. So by that, thank you very much.
Right. Thank you very much, Professor Dr. Wan Amir, for the very interesting talk. So we have several questions here. I hope we'll be able to address all of these 3 questions at the moment from the chat box, Q&A chat box. The first question is, was there an increase in the total cholesterol with the administration of the compound? And if so, why?
Actually, to say, as you can see from this slide, okay, as you can see, there's not sort of like what we can see, there's not much different as compared to the normal. Okay, because as you can see in the untreated, the level is actually significantly higher as compared to the what they call normal rats. But for the abstract, basically, it significantly reduced of the total cholesterol level. So actually, it's not an increase in the total cholesterol as per se, still within the normal limits of the what they call cholesterol level in rats, basically.
All right. So the second question is, the treatment with 1,000 milligram per kilogram gives comparable effect to that of metformin. Is it known how EAE is metabolized, and has the safety margin has been established?
Okay. For this question, basically, we have not proceeded yet with the pharmacokinetic study of this plant. That's why actually the study is need to be further evaluated, especially on their pharmacokinetic profile. However, for the next question, the safety margin of this plant, actually, we already study using this branch assay, the MCT assay, the in vitro study, and also we have also done the in vitro study started from the acute study. Then we proceed with sub-acute study, and also we proceed with the subchronic study. And we have found that the plant actually did not produce any what they call adverse effect, even up to 5,000 milligram per kilogram, which is according to this OECD guideline. But we have not proceeded yet for this teratogenic study. So hopefully by what they call within next year, hopefully we can establish the full safety profile of the metformin. However, from the current result, we have shown that up to 5,000 milligram actually did not cause any adverse effects on the rats.
Right. The next question is there a particular compound that you look at or only could? I'm assuming maybe he was asking, or she may be asking, the extract mode of the compound.
Yes, okay. Our pilot study actually started with the fruit extracts, and then we proceed into this what they call identification of the active compound in general. So basically, we have identified that this extract is actually high in flavonoids, and we proceed to identify a specific compounds that present within the flavonoid groups, and we have found that mainly on anthocyanin, and specifically is the cyanidin. And hopefully, in our further study, we're going to sort of like have a collective, what they call a compound of this flavonoid. We would like to study not just the single active compound, because as we know that currently most of the single active compound is not active on its own, or it cannot produce what they call the main effect alone. So that's why most likely we're going to try to the combination of the compounds that are present, especially flavonoids in this plant, because we know that it's going to produce a synergistic effect rather than one single compound. So hopefully it's going to be a standardized extract, and also mainly on this flavonoid compound, also called this high flavonoid extract rather than one single compound.
All right, we have a lot more questions coming in. Is it an idea to investigate which cells in the kidney that are responsive to EEAE treatment, leading to downregulation of interleukin 6?
Okay, currently this is more. Okay, currently basically the one that we present actually basically is what they call as the general study first, because we want to look at in general what is the effects of the compound in general on this what they call anti-inflammatory markers. So hopefully by doing this, we can have some idea and that this compound also sort of like has anti-inflammatory effects. So hopefully for the next further studies, we're going to sort of like study more on the cells and study more on the mechanism, how this plant basically affects the inflammatory markers and also affects this what they call pathways, or whatever pathways that can lead to this action.
Right. It's already 10, but are you happy to take more questions? If you are, we'll finish at 10:05 because we started a bit late just now. Dr. Amir?
Yes, I think it's okay as long as we. What about our schedule? So
we can just extend until just 10:05. All right.
Okay, no problem.
Then we'll stop. All right. So the next question is, the anti-diabetic effects of the alligator is due to a single major flavonoid, or a single, a major flavonoid or the combination mixture of flavonoids?
Okay, that's why currently actually we have sort of like we have a general idea that is going to be a flavonoid that mainly responsible to this action of this plant. But as far as we know, we try to sort of like what they call, because we know that flavonoid basically has been shown, okay, by previous study that what they call has this in vitro anti-diabetic properties also, and also anti-inflammatory properties. So that's why basically we try not to single out a single compound as the main effect. So that's why we like to sort of like have a combination of mixture of flavonoids, because as you know, usually two mixture can provide a what they call synergistic effects rather than one single compound. But however, this is warranted for further study. So hopefully the next study we can sort of like elucidate this more rather than one single compound.
Right. The next question is, how do you extract the specific compound? Is it through HPLC and then followed by LCMS-MS?
That we are going to leave to our collaborators, which is the phytochemistry. But basically, that's what our sort of like plan is basically. So hopefully, he can actually extract the what they call at least two compounds that present in flavonoid. But to be in mind, to keep in mind, basically, we also have identified basically the anthocyanin, which is the what they call cyanidin. So hopefully, afterwards, in our further study, we can sort of identify the compound, the flavonoids compound, more specific.
Right. How about the volatile compounds from the plant?
Actually, for this volatile compound, actually, we not really study into it. We are more study on this what they call flavonoid. Try to concentrate more on flavonoid rather than try to study the other compound. But perhaps there is or there are volatile compounds in Kantan.
Mm-hmm. All right. The final question would be, if we would translate this research to human study, how much of the extract would one take? Would you think there will be an improvement on local diabetic wounds if applied locally?
Okay, that's why I think if you are translated into the human, of course, it's going to be more study that we have to do. But basically, the study in the wound itself, as far as I know, has not been done before. But perhaps with its anti-inflammatory properties, maybe also it can improve this what they call diabetic wound when it's applied locally, hopefully.
Thank you very much, Associate Professor Dr. Wan Amir, for the very interesting talk. We've come to the end of this session. Thank you very much, Dr. Wan Amir, once again, and of course the attendees for joining the session. Our next session is the oral presentation, which will begin at 10:15. There are two rooms, room 1 and 2. If you'd like to hear you can find the list of the finalists of oral presenters at the webpage and choose which rooms you'd like to enter. With that, we conclude the session. Thank you very much, everyone. I'll see you guys at 10:15 in the same room or the other room. Thank you, everyone, and see you soon. Goodbye.